Hi, this is Dr. Meghan Karol, a pelvic health physical therapist. So in the months prior, I talked a lot about what is the pelvic floor, what are some normals to expect. So if any of those things resonated with you, or many, many more things that we didn't even mention, and you find yourself or your provider is recommending to go to pelvic floor physical therapy, you might be thinking, what the heck is that going to entail? I don't know if this is for me. So let's sort of debunk some of those things, make it, a little bit more approachable on what to expect on that first visit, as well as sort of overall in your treatment plan. So in physical therapy, if you've ever gone for your back or your neck or before surgery or after surgery, I always kind of say physical therapy in general, we're looking at the muscles, joints, ligaments, and how all those things are functioning for your day-to-day. And the pelvis is no different. It is made of muscles and joints and ligaments and bones and all of those functions for your day-to-day. We've talked about those functions before. So on your first visit, first of all, it's a lot of history taking, just like going to any doctor's office. They're going to have intake forms to get an idea of what are the things that are bothering you, what are your goals for physical therapy, and then we're going to talk a lot. I always kind of say I like to hear it straight from the horse's mouth. I can read some things, but to actually hear you talk about it gives me a better idea, and then have follow-up questions to really understand what it is that's bothering you, how it's impacting your day-to-day, and what your goals are. What do you want your day-to-day to look like? So it's actually a lot more talking than sometimes you realize. And I always kind of say, again, the functions of the pelvic floor are a little taboo. We don't really like talking about them sometimes, but when I'm asking these follow-up questions, this is what's living in my head. Nothing that's going on in the bathroom, nothing that's going on in the bedroom. That's not what's living in my head. It's actually the muscles and the joints and the ligaments and how those are functioning for those activities. So make sure that you're talking to your comfort level, but just know that there's almost nothing that your pelvic physical therapist or your gynecologist hasn't heard before. So yeah, lots of talking, lots of history taking, and then an actual physical assessment. So the pelvis doesn't operate in isolation. So for me, I'm always looking at someone's posture, someone's movement, how all of those things may or may not be impacting the pelvis and the pelvic floor. And then for the pelvic direct exam, and I will say there are some therapists out there that don't do any internal assessment, or maybe not right away. So it depends on who you're seeing. But for the most part, most of us immediately think about a gynecological exam. And unfortunately, some people have had negative experiences with that. It's not an enjoyable experience. But what I always kind of say is the role of a gynecologist is to get to those pelvic organs. They have to get to those deeper levels. So they kind of have to bypass through the muscles. Where in pelvic physical therapy, what we most care about is those muscles. So it's a much kind of slower process. It's not quite as deep. There's no speculum. There's no stirrups. It's just me in a glove. But we're going to look externally, kind of look at the bony alignment, look at those muscles that we can appreciate, those kind of right close to the surface muscles. Maybe ask you to do that Kegel squeeze, see how you react. Maybe ask you to take a couple deep breaths, see how that reacts. Ask you to cough or sneeze. Does it engage or does it kind of bottom out? A lot of different things. Assess if there's any scarring. If you had previous vaginal births and there's some scarring, even looking abdominal, if you've had a cesarean birth, seeing what that scar mobility is like. And then as long as your body's accepting and you are accepting and everyone's on board, then we'll actually do an internal assessment. I can actually access a lot of these muscles via the vaginal canal or via the rectum. Again, depending on what's going on, we can cross each bridge as we get there. But just again, me in a glove, going through one layer at a time. There's 3 layers to the pelvic floor muscles, each about a knuckle deep. So first we're going to start very superficial, right at the entrance of the vaginal canal. Is there any tightness? Is there any tenderness? So just like you can get a tight, sore muscle in your neck or your back, you can get those in your pelvic floor muscles. Gradually working a little bit deeper to those deeper layer muscles, seeing if there's any tightness, any tenderness. Again, asking you to do a Kegel squeeze, maybe asking you to do an activity to see, are those muscles engaging and coordinating the way that we want them to, or not quite right? And then from there, coming up with a good treatment plan. Now with pelvic physical therapy, again, it's not all in the pelvis. The pelvis doesn't operate in isolation. So maybe there are going to be some exercises or some treatment strategies that are very specific to the pelvic floor, engaging those muscles, relaxing those muscles. We actually use breath a lot because your diaphragm sits on top, your pelvic floor sits on bottom of your abdomen, of sort of your core canister, and they work together as a team. So we can kind of utilize your breath to influence some things. We're going to work on, again, maybe direct strengthening, asking you to do that Kegel squeeze, which is an isolated contraction, or we might kind of work on more global strengthening, having you do hip strengthening, core strengthening, making sure the muscle is coordinating together with those and not getting overwhelmed by other muscle activity. So that way, as you're operating through your day to day, the pelvic floor is a part of your balance. It is a part of your general movement and stability. So we want to make sure all that's working together. Most likely addressing and looking at your flexibility, your mobility. Can you move your hips in full range of motion, move your spine in full range of motion? So sometimes we're also working maybe even in the upper back or even in the jaw has relation to the pelvic floor. So your pelvic floor physical therapy experience could look a lot of different ways depending on what your therapist sees and assesses and feels like is important for your treatment plan. So hope that helps. Hope that makes that first appointment a little less scary, but you're always in charge. You're in charge of your body and your body's in charge. You might be saying yes, but if your body's saying, whoa, no, and spasming, then we're gonna adjust accordingly, and that's where our treatment starts.